Thank you, Chair. I strongly support the clause as is, and I thank the AMA of South Australia for their particular conversations that they've had with me on this particular matter about conscientious objection. Members have noted that there is a range of views about conscientious objection, and in fact I think this strikes a nice balance and is supported in that case by the AMA in consultation both with that participation and the recommendations of SARI and, of course, the Attorney-General, as the Minister for Health and Wellbeing has touched on. I do note that this bill removes the criminality of abortion and treats it as a healthcare issue. And so analogies around being an accessory for a robbery in a getaway car or getting a gun to kill someone are analogies that refer to abortion as a crime. Myself, I don't believe that abortion is a crime. I believe it is healthcare, and I will treat it as such. I certainly also don't want to see doctors who say that they will leave their profession having had years of medical training, having committed themselves to that vocation, but for this, for having to pass on a piece of information to their patient, will quit that vocation, rewarded for that stance. I believe that it is, in fact, a duty of our medical professionals to ensure that people have informed consent and have information. And when you go to a doctor, you are often seeking their assistance. That assistance should include the full range of information. And should they not be providing you with that full range of information, they should have to make that known to you. We do know that there are doctors who do refuse to tell their patients about the full range of options, and that they are the people, in fact, that we see having to have abortions in later parts of that pregnancy because they have not been given the medical assistance early on that they should have been given by those medical professionals. And we saw from the SARI report that it doesn't stop just with the termination of that pregnancy. It also continues when often that girl or that woman returns home, perhaps to Kangaroo Island, just to name one of the examples covered in the SARI report, to be refused aftercare when things go wrong because they are continuing to judge that girl or woman for her choice to have had an abortion. And she is left on that small island without the access to the health care that is her human right and should be afforded to her for full dignity. So if doctors are going to quit their jobs over having to pass on a piece of information to give that patient the full range of options, then I say good on them. They should quit that profession because they are not worthy of the name doctor.